Sip. Kambing-kambing sedang balapan makan. Kambingnya 5 ekor. Lobang lehernya.
Caprine Arthritis and Encephalitis virus, CAEV, infection is manifested clinically as polysynovitis-arthritis in adult goats and less commonly as leukoencephalomyelitis, progressive weakness, ataxia, proprioceptive deficits in kids. Subclinical or clinical interstitial pneumonia, indurative mastitis, hard udder, and chronic wasting have also been attributed to infection with this virus. However, most CAEV infections are subclinical. Infection with CAEV decreases the lifetime productivity of dairy goats and is a barrier to exportation of goats from North America. CAEV infection is widespread, seroprevalence rate greater than 65% among dairy goats in most high-income economies such as Canada, Norway, France, and the US, whereas it is comparatively rare among indigenous goat breeds raised in lower and middle-income countries, except where there is a history of contact with imported goats. Caprine Arthritis Encephalitis virus is an enveloped, single-stranded RNA lentivirus in the family Retroviridae. There are several genetically distinct isolates of the virus that differ in virulence. CAEV infection is widespread in dairy goat breeds but uncommon in meat and fiber-producing goats. This distinction has been attributed to genetic factors, management practices such as feeding colostrum and milk from a single dam to multiple kids, and farming practices in high-income countries, e.g., frequent introductions of new animals into a herd. Prevalence of infection increases with age but is apparently not influenced by sex. Most goats are infected at an early age, remain seropositive for life, and may develop signs of disease months to years after infection. The chief mode of spread of CAEV is via ingestion of virus-infected colostrum or milk by kids. The feeding of pooled colostrum or milk to kids is a particularly risky practice, because a few infected will spread the virus to a large number of kids. Horizontal transmission also contributes to disease spread within herds and may occur through direct contact, exposure to fomites at feed bunks and waterers, ingestion of contaminated milk in milking parlours, or serial use of needles or equipment contaminated with blood. Unlikely methods of transmission, as indicated by results of experimental studies, include in utero transmission to the fetus, infection of the kid during parturition, and infection via natural breeding or embryo transfer.